Hello everyone, welcome to our channel. My name is Shrishna and today we are with Dr. Harshad Jawalkar. He is one of the leading orthopedic surgeon in Hyderabad who is also exclusively specialized in the shoulder surgery from prestigious King's College Hospital in London. Let's also meet the managing director of the shoulder center. Let's welcome him. Hello sir, how are you doing today?
Hello Srujana and namaste viewers. I'm doing very well. Thank you so much for having me on this channel. It's my pleasure to be here.
We are so glad that you are here with us.
Pleasure is all mine.
So sir, what are the fractures around the shoulder?
Okay, so that's a very good question. It's a very common problem nowadays with the road traffic being so bad, and also because of elderly people being alone at home. There are lots of fractures which can occur around the shoulder. So basically a fracture is a break in the bone. So any bone, once it breaks, it's called a fracture. So let's start with a little bit of basic anatomy for our viewers. So this is a model of the shoulder joint. So there are three important bones which form the shoulder joint. The first one is the collarbone. Fractures of these are very, very common, especially in youngsters after falling off from bikes. They have the collarbone breaks, which is known as a clavicle fracture also. Most of the times it breaks in the middle, and these can be treated without surgery. So this was what we used to do say a few years ago. But some people, the conservative manage, that means without surgery they don't heal that well, they cause problems in the long term. So nowadays for a few select group of patients there are surgical options available also, which improve the healing time and also give better function after the bone heals. Collarbone fractures which occur at the lateral end, that occur at the outer end, they sort of destabilize the whole shoulder. The arm is not in the correct position because of disruption of some ligaments. These usually need surgery. The second part is the arm bone, the top of which forms the ball of the shoulder joint. So again, these fractures are also very, very common. They occur in two types of patients, in which the first one is in youngsters after they have an accident in which they are involved in high-speed road traffic vehicle collisions, hit by bikes, hit by cars, falling off two-wheelers, those sort of things. And again, it all depends on how badly the pieces have displaced. There are lots of muscles covering the ball of the shoulder, and they pull the fractured bits of the bones in different positions. So in youngsters, again, the treatment is usually with surgery to try to get back the anatomy as close to normal as possible. And this usually gives a better outcome in the majority of the patients. Of course, if it's a very, very minor fracture, some people call them hairline fractures, in which there is not much movement of the bones, these fractures can be managed without surgery by putting a plaster or an arm sling or something of that sort. These injuries, they take around 1.5 to 2 months to heal, after which there usually is not much of a problem. The second subset of people in which the arm bone, the proximal humerus as it is called, it breaks, is in the elderly people. So relatively osteoporosis, that means the bones become weak with age, and once these elderly people beyond 55, 60, 65, even a simple thing like a slip in the bathroom or a slip on the road, and if they land on the shoulder at that time, this can break. And again, these can be managed relatively easily without any sort of surgery. Exceptionally, when the bad is exceptionally bad, when the fracture is exceptionally bad, then we might have to think about surgery in these elderly people also. And the third important bone which can break is the socket part. So this is the shoulder blade. The socket of the shoulder forms a part of the shoulder blade known as the scapula, and occasionally the socket also breaks. This is a relatively uncommon injury. Not many people have this injury. It's seen in accidents, high energy accidents more often, and the treatment again depends on whether the fractured socket is still held in place, whether it is a hairline fracture or an undisplaced fracture, or whether it has disrupted, whether the socket is not in its place, there's lots of movements of the broken pieces of bone. So these can be managed either with surgery or without surgery, depending on each patient. One thing I'd like to say, Srujana, for our viewers, is that the treatment is not just based on the X-ray picture or the MRI picture or the CT scan picture. We have sort of scientific evidence about how to treat each and every injury, but the most important decision factor that at least that I follow is the patient. So I don't treat the fracture as it appears on the X-rays or the films, but it is the patient as a whole that needs treatment. So the same fracture treatment might be different for a youngster, a college student, a 20-year-old guy who plays cricket. It might be different for a 25-year-old sports person who needs very good function of the shoulder. It will be different for a 45-year-old housewife who doesn't have that much demand on the shoulder, and it will be different for a 65-year-old grandfather who has fallen in the bathroom and has these things. So the treatment of all these fractures depends on the patient as a whole and not just on the X-ray or the investigation.
Understood. Right.
So this was a bit of the basics about the fractures.
So thank you so much, doctor, for giving us informative details on the most significant body part, that is shoulder.
Thank you so much, Rujana and Suman TV. It was an absolute pleasure talking to you, and all the best to our viewers.
Viewers, please like, share and comment. You can always drop a question that you wanted to ask to a doctor in the comment section below, and please call to the number which are scrolling in our video. Plus, you are always happy to visit the shoulder center, which is located in row number 12, Banjara Hills. Thank you so much for watching this video.